This morning is Cynthia Carmona, who's a policy analyst with the Community Clinic Association of Los Angeles County. Welcome, Cynthia.
Good morning. Thanks for inviting me to speak here today. Let me just get this started. And I'm going to speak to you a little bit today about health cuts in the budget that affect immigrants and just communities at large here in Los Angeles. Okay, so let me just tell you a little bit about the Community Clinic Association of LA County to start out with. In LA County, about 63% of our member clinics patients are uninsured individuals. And so when we talk about different funding programs for healthcare, those programs are, we talk about programs like Medi-Cal. Those are even more important to our clinics. We have about 42 clinics. We represent 42 clinics countywide, which have over 125 clinic sites throughout the county. Just to give you a little bit of information about our demographics, we don't have immigrant demographics per se, but I can give you some diversity demographics. Our patients make up about 67% of our patients are Latino or Hispanic, 9% are African American, 6% are Asian Pacific Islander, and about 1% Native American. So that just gives you a little bit of a breakdown about who we serve. Also, Medi-Cal makes up about, because that's going to be primarily what I'm talking about today, makes up over 30% of our clinics' revenue countywide. However, when you drill down into clinics individually, certain clinics certainly rely much more on Medi-Cal. So some of the clinics see over 50% of their revenue come from Medi-Cal. So that's why this is so important. Talking about last year's budget proposals that were discussed, there was certainly a lot on the table that we were very nervous about and that we were advocating strongly against. There were provider rate reductions to Medi-Cal providers, and those were specific providers, 10% and 5% that were proposed. Quarterly status reports for Medi-Cal eligibility for children, so every 3 months, parents with children would have to resubmit their income to determine whether they're still eligible for Medi-Cal, reducing the income eligibility level for two-parent households to 61% of FPL, and parents were not allowed to be working over 100 hours a month to remain eligible for that no share of cost Medi-Cal. Delayed implementation of SB 437, which would have streamlined enrollment in Medi-Cal and healthy families, and then elimination of optional Medi-Cal benefits, which I'm going to get to in a minute. Specific proposals that affected immigrants, but I'm sure you were all aware of, was they eliminated full scope Medi-Cal for new immigrants and those with crew call status. They would only be eligible for emergency services, not full scope Medi-Cal services, except for prenatal care, nursing facilities, and breast and cervical cancer treatment. They also wanted to limit eligibility for emergency Medi-Cal services for undocumented immigrants to a month-to-month type of eligibility system, where if an immigrant went into the emergency room, they filled out the paperwork, they became eligible, and they were eligible for emergency services for an entire year. According to the proposal, they would only be eligible for the month that they first received services to go back to the emergency room. And so if they had another episode the following month, or the month after that, they would have to go back through the eligibility process all over again. So the good news was that we had a lot of advocates in the Capitol in the form of legislators who advocated strongly against the immigrant proposals for Medi-Cal. But we did end up with some enacted budget provisions that still are going to really affect our immigrant communities here in LA County. 10% cut to provider reimbursements through February, and then they were going to reduce that in March of this year. Now the problem with provider reimbursements, which I'm sure you're all aware of, is that Medi-Cal pays a very low rate to providers that provide Medi-Cal services, and it's already one of the lowest in the country. And so reducing that rate even further makes more doctors unwilling or unable to provide Medi-Cal services. So that resulted in litigation, which is actually still ongoing, and also resulted in some injunctions, so that Medi-Cal providers, at least the ones that we're concerned with in primary care, are only going to see about a 1% cut. So it's still a cut. It's a cut that we're not happy with, but it's not 10%. But we are going to be fighting in the coming year with healthcare reform to increase that Medi-Cal provider rate. Also, instead of quarterly status reports, we got semi-annual status reports for children. So that's twice a year. Every 6 months, they'd have to resubmit. And so that's, again, something that we're not happy about. And I think that's something that, I don't know how much they're going to talk about it in the federal presentation, but we did hear today that the governor will sign SB 3X24, which will revert that back to the annual eligibility in order for California to receive federal stimulus dollars that are important to close that budget gap. There's an increased premium for healthy families and a cap on dental coverage in healthy families. So the enacted 2009-10 budget, which just happened a couple of months ago, established a trigger mechanism, which is something unique that has not really happened before in budget negotiations. Basically, it's dependent on the amount of federal stimulus dollars that California will receive as a part of Obama's stimulus package. And basically, what it says is that it put a bunch of cuts on the line if California does not receive at least $10 billion in federal stimulus funds by June 30th of 2010. Now, the way that this happens is the state treasurer and the state director of finance have to get together on April 1st to determine whether we're going to meet that threshold. They've already held a hearing this month, and it's not looking good. It's looking like we're going to be about $2 billion short according to their calculations, and there's some debate over how that's calculated. But we are expecting that they are going to cut certain benefits. I think it's July 1 is when those go into effect. So what are those trigger cuts? Well, healthcare-wise, we're really concerned about Medi-Cal optional benefits. And there's about a dozen here, a little less than a dozen, which include adult dental, chiropractic care, acupuncture, audiology, optometry, opticians, podiatry, speech therapy, psychology, and incontinence creams and washes. Now, the things that we're really concerned about at the Clinic Association are the adult dental. We expect that to really hit our clinics hard. And the reason for that is while children typically come with a funding source, whether it's S-CHIP or some other funding source to cover their dental, adults really don't have any other way to pay for their dental coverage if they're uninsured. And so the problem with a lot of our clinics is they don't feel that many of them can sustain themselves with only the children's piece. So we're looking at, with the adult cuts, that we're also going to see the loss of services to children in dental. So we're really concerned about that. We've been advocating against that strongly. One of the other benefits we're really concerned about is podiatry, given the diabetes in the population. There's a big concern about diabetes, and podiatry has been essential to diagnosing and treating diabetes in communities. So the elimination of these optional benefits will not apply to pregnancy services, those in nursing facilities, and the EPSDT program. There's also a 10% reduction in public hospital reimbursement rates, which is also critical in LA County. So I just want to make sure that you guys are aware of that. So what does this mean for services in LA communities? I already stated about the dental cuts. Just to give you some numbers, LA County had over 800,000 Denti-Cal beneficiaries in 2007. I'm just going to keep going. Roughly 350,000 of those were adults. And our members, our clinic members, provided nearly 200,000 dental encounters in 2007, and that was a jump up of 11% from 2006. So one of the really unfortunate things about the dental aspect of this is that we've really made some big strides in the last 5 or so years in dental in the communities, and now we're looking at really ratcheting that back if we see these cuts happen in July. So just to give you a little bit of some information about what's happening right now to kind of fight against some of these cuts. We've been arguing with a lot of our coalition partners at Stop the Cuts and at APALC, and I see ACLU over there, against a lot of these cuts, including some of the other services. But because we're seeing that it's probably going to happen, we do anticipate that a number of groups are going to pursue legal action on this. And there's several routes that can be taken. Some will argue against the abandonment of treatment, arguing that when people are on a treatment plan, you can't just take services away from them while they've already been diagnosed and they're in the middle of something. Another angle is many of our clinics are what are called federally qualified healthcare centers. They rely heavily on federal funding through a federal program to fund community clinics. And it's still being debated whether dental is a mandatory service in FQHCs, and in that case it could get a little tricky. So that's just a little bit about what's happening in the healthcare side of things on the budget. Just to let you all know, we will be having our annual policy summit on May 22nd of this year at the Cathedral, so we encourage you all to check out our website at ccalac.org if you are interested in attending that. So thank you very much.